The world is a strange and wonderful place, and unfortunately for some, the world of medical disorders is just as strange and a whole lot less wonderful. Most of us take our health for granted, and yet there are millions living amongst us with medical conditions that are not just debilitating, but truly bizarre. Hello and welcome to another episode of the Infographic Show. Today we're going to tell you about some of the most bizarre medical conditions in the world. Non-stop hiccups. Hiccups are a pretty benign reaction triggered by an irritation of the diaphragm caused by the stomach, and typically occurs only after we eat or drink too much too quickly. Yet in 2009, Christopher Sands had been battling hiccuping for over 2 years, stating that the hiccuping started out of the blue and for no apparent reason. Sands at first did what most of us would do, a whole slew of random remedies gleaned from family, friends, and the internet. Yet despite special drinking cups, hypnotherapy, yoga, and even herbal remedies from the Far East, the hiccups wouldn't stop. Doctors investigating Sands' condition looked for a source of irritation on his diaphragm, or possibly a perforation, and yet test after test discovered nothing wrong with him. The only possible culprit was a damaged valve that connected his stomach to his esophagus, but this was a condition he had been born with, and other than frequent heartburn and vomiting, had not caused any hiccuping previously in his life. The hiccuping can strike completely out of nowhere and plagued Sands for hours, making sleep, eating, or performing on stage with his band impossible. According to Sands, he could hiccup for 14 hours non-stop, or go through periods where he was completely free of them, although he always felt that he was about to hiccup at any moment, similar to the way you might feel when a sneeze is on its way. Sands traveled across Britain for almost 3 years before a Japanese company making a TV show about him flew him to Tokyo, where an MRI scan diagnosed him with a small 1.2 centimeter growth on his brainstem. Despite being warned that the tumor was inoperable by the Japanese doctors who discovered it, Sands immediately flew home for a complex brain surgery. The surgery was a success, yet left Sands with difficulty coordinating his movements and some numbness on his left side. Still, for the man who had hiccuped non-stop for years, it was well worth it. We suppose it was truly lucky that Sands was British and had the rapid and life-changing surgery without also going bankrupt from medical bills. Now you see me, now you see nothing for 3 days. Some nights, Natalie Adler of Melbourne, Australia will feel her eyes getting quite heavy, and not with sleep. Yet when she eventually does go to sleep, she wakes up unable to open her eyes. The strange affliction generally lasts about 3 days, after which she's once more able to open her eyes normally and see just fine. Flown to doctors both in Australia and the US, where she must have incredible insurance, neither nation's physicians have been able to diagnose a cause for her condition. Per Dr. Dean Sestari, a neuro-ophthalmologist at the Massachusetts Eye and Ear Infirmary in Boston, there's nothing that would cause symptoms of a woman to close her eyes for 3 days and open her eyes for 3 days. Sestari believes, however, that the physical condition may be the manifestation of a psychological one, with her mind converting some internal conflict into a physical ailment. Now aged 30, Adler has had 99% of the muscles in her eyelids removed to keep them from closing shut, and yet her eyes will still squeeze shut at least once a month. She relies on constant Botox injections to help keep her eyes open, yet says that the treatments are losing their effectiveness. Constantly turned on. Persistent sexual arousal may seem like a funny joke to some, but for the women who live with PSAS, it's a daily nightmare. Not formally recognized until 2001, PSAS sees women living constantly on the brink of an orgasm, and yet the symptoms are only partially relieved through an actual orgasm. Sex itself can often not help quell it either, and in fact might make it worse. Research into the causes are still rudimentary and has left doctors baffled, with no obvious underlying physical or psychological cause. Yet when the topic is brought up, many snicker and laugh at its mention, which leads doctors to believe that thousands of women may suffer from the condition yet never seek treatment out of embarrassment. For those afflicted, despite the jokes, they see the condition as a curse, and one woman who suffered it her entire life says that she would rather never experience an orgasm again than to continue to live like this forever. The real Iceman. Wim Hof has a pretty strong resistance to the cold, yet for a native Dutchman that's no great boast. The Netherlands sees some pretty cold winters after all. What makes Wim Hof unique though is just how resistant he is to cold, which borders on supernatural powers. In one stunt, he immersed himself completely in ice water, with just a pair of shorts for modesty, and stayed there for an hour and 12 minutes, at temperatures similar to those that killed the passengers of the Titanic in minutes. Then in January 1999, he went 100 miles north of the Arctic circle to run half a marathon in his bare feet. In 2002, and dressed up only in a swimsuit, he dove under the ice at the North Pole and earned a Guinness World Record for longest distance swimming under the ice, 80 meters. He has even scaled Mount Everest in just his shorts. Hoff explains that he discovered his supernatural abilities over 30 years ago, when while strolling through a park as a teenager he saw the ice-covered water and thought to himself, what would happen if I go in there? For most people, the answer would be instant hypothermia followed by possible death. And yet, feeling an insatiable desire to strip naked and dive in, Hoff hopped into the frozen water and said he felt amazing when he got back out. He immediately turned the stunt into a routine, and years later had discovered superhuman abilities to withstand freezing temperatures. With most people unable to survive such exposure to extremely low temperatures without at least losing a few toes to frostbite, Hoff has explained that he believes his powers come from nothing more than a specialized set of breathing techniques. Marketing the techniques around the world, Hoff has drawn some consternation from the relatives of at least 2 people who died after trying to follow his exercise program by replicating his cold water immersions. Allergic to cold. Wim Hof may have a superhuman ability to withstand the cold, but unfortunately for some, their superhuman power lies in being super susceptible to the cold, to the point of being physically allergic to it. And no, we don't mean the excuse you make up when you're tucked in under a warm blanket and your alarm rings to get ready to go to work. These people suffer physical ailments from exposure to the cold, no different than what many would display as allergic reactions to materials, food, and insect bites. Known as cold urticaria, these individuals can develop huge welts if, for instance, you place an ice cube on their skin, and exposure to winter winds and cold can prompt these debilitating symptoms. Having a few snowflakes land on their face may elicit a response in the form of itchy and uncomfortable bumps, while diving into a cold swimming pool could induce a potentially lethal allergic shock. Dr. Gerald Gleich at the University of Utah says that some of his patients have experienced full-blown vascular collapse and ended up at death's door just from the act of going outside in the winter. He goes on to explain that the reaction to the cold is brought about by an inappropriate immune system response. In this case, an antibody known as immunoglobulin E is the prime suspect. While no cure exists, the good news is that the same allergy relief you may seek out for springtime's heavy pollen blooms is also effective for sufferers of cold urticaria, and antihistamines provide relief for those afflicted. But I'm not tired. It's natural for most 4-year-olds to resist bedtime, yet in 2009 for Rhett Lamb of the UK, going to sleep was impossible. Per his mother, the boy would stay awake for nearly 24 hours a day, and his sleeplessness manifested at birth. Concerned that her baby wasn't sleeping, his mother went on frequent visits to the hospital. But the doctors assumed she was just being a nervous mother. Only after a year of little to no sleep did medical experts begin to take the condition seriously. But it would take a further 3 years for a diagnosis to be discovered. Rhett was diagnosed with a very rare condition called Chiari malformation, in which the brain is squeezed into the spinal column. This causes compression and strangulation of the brainstem, which is where vital functions that control sleep and speech are located, along with areas responsible for regulating our circulatory system and even our breathing. The boy, who had been sleepless for years, had grown extremely irritable and unsocial. Underwent immediate and very risky surgery, with the doctors removing a portion of the bone around his brainstem and spinal cord. Initially, they expected 50-50 odds on seeing any improvement, but a year later, Rhett was once more able to sleep, and his behavior has dramatically changed as a result. If you think you're cranky when you can't get a nap in, try and see how cranky you'll be after 4 years of no sleep. You're not from around here, or are you? Everyone knows that severe brain trauma can have long-lasting and serious effects, everything from landing yourself in a coma to losing partial or full control over your body's functions. Yet for some people, severe brain trauma can have an altogether very peculiar effect: the development of a completely foreign accent. Canadian Rosemarie Dorr suffered a stroke on the left side of her brain in 2006, and very quickly after developed a strong Eastern Canadian accent, despite living in West Canada and having never visited the region or even knowing anyone from there. Visited by a nurse from Newfoundland while recovering from her stroke, Dorr recounts that the nurse came into her room and asked, "Who's the Newfie here?" in reference to Newfoundland. Dorr replied that there was nobody there from that region, to which the nurse said, "I think I'm talking to her." That's when it dawned on Dorr that her speech had radically changed. Extremely rare, foreign accent syndrome has only 60 verified cases in medical history, with one of the first known sufferers being a Norwegian woman who during World War II was hit in the head by a bomb fragment. After recovering, the woman began to speak with a strong German accent, which led to her being targeted by those with strong anti-German sentiments. Yet the condition remains to this day, with a Florida woman developing a British accent, a Japanese woman developing a Korean accent, and a man from rural South Carolina developing a strong French accent. Doctors remain perplexed as to the cause, but are convinced that it's the result of neurological damage suffered after trauma, such as that experienced during a stroke. While it may not be truly debilitating for its sufferers, it is certainly strange, and no treatment has yet been developed. The world really is a strange place, and life can be difficult enough without developing one of these abnormal and extremely rare disorders. While medical science constantly makes new breakthroughs, it seems that the complex machinery of the human body still confounds scientists, and at times baffles our explanations of what should be physically possible or impossible for the human body to do. Hopefully, in time, science will learn to treat some of these most serious medical ailments, and maybe even give us some of the rare benefits, such as being able to withstand extreme cold, or perhaps switch our speaking accents at will. Which of these problems do you think would be the worst to live with? Also, check out our other video, Most Painful Things a Human Can Experience. Thanks for watching, and see you next time!